Electroshock therapy, or EST, is a controversial form of psychological therapy where patients are given electric shocks, inducing seizures. It was first introduced by Italian psychiatrists in 1938 and became more popular in the 1940s to specifically address overpopulation in the U.S. Electroshock therapy is the evolution of shock therapy, which originated 4 years earlier in 1934 in Hungary by neuropsychologist Ladislas J. Meduna, who injected convulsive drugs into his patients to induce seizures. Within 3 years, this therapy went global in an international conference in Switzerland. A year later, Italian psychiatrists Ugo Cerletti and Lucini Bini came up with the idea of using electric shocks instead of using convulsants.
These days, electroshock therapy is most often used to treat depressed or suicidal people. However, it is also used when a patient has severe depression that is accompanied with psychosis, depression that will not get better by taking medication, severe mania, catatonia, or to treat people with agitation and aggression in people with dementia.
There are many risks involved with electroshock therapy. EST can lead to extreme confusion, which can last for a few minutes to several days. Other risks include increasing blood pressure and heart rate, which can result in heart problems. Nausea, headaches, muscle spasm, and vomiting may also occur, but they can be treated with medication and usually disappear after a few days.
When treating severe depression, acute psychotic traits, and mania, probability of remission has been reported to be around 60 to 70%. However, when trying to treat dysthymia, substance abuse, anxiety, or a personality disorder with electroshock therapy, its effectiveness is not as high. Also, when treating suicide, electroshock therapy is said to be a short-term treatment. As bad as electroshock therapy sounds, the recovery rate of patients that were undergoing convulsive therapy turned out to have a much higher recovery rate than usual. In 1941, an account of electroshock therapy was to jolt a mental patient out of his dream world and back into sanity. Kitty Dukakis, wife of politician Michael Dukakis, reported to have said in a Newsweek article that memory loss is an acceptable price to pay for relief from depression.
However, there is one overpowering negative to electroshock therapy, the effect it has on the mind. Peter Breggin, a psychiatrist, showed through his books that electroshock therapy causes considerable damage to the brain, disrupting cognition and leading to severe memory loss, sometimes permanent. Amnesia is a very common side effect of EST.
Negative accounts of electroshock therapy was repeatedly reported by many individuals over the years. Revered author Ernest Hemingway is said to have committed suicide shortly after receiving electroshock therapy. According to the News Medical website, Hemingway is reported to have said, "Well, what is the sense of ruining my head and erasing my memory, which is my capital, and putting me out of business? It was a brilliant cure, but we lost the patient."
Problems would often arise administering EST in the past. Harmful amounts of electricity were administered, and because of a lack of anesthesia, broken bones were very common. Nowadays, however, problems only arise when patients do not prepare properly for the treatment. When patients lie about their medical history or do not prepare proper tests, they're significantly at higher risk of serious side effects.
In order to receive electroshock therapy, legal consent of the patient is required. The World Health Organization states that EST should be administered only after obtaining informed consent. Also, before giving a patient electroshock therapy, the U.S. doctrine states that a doctor must state the risks and benefits of treatment, risks and benefits of alternative treatments, and the risks and benefits of no treatment.
There are also positive endings for people who go through electroshock therapy. Dr. Sherwin Nuland, a notable surgeon and author, is an example of someone who would have had to undergo lobotomy due to a lack of other treatments if electroshock therapy had not been suggested and effective in curing him of his depression and compulsive behavior. Describing the treatments, he says, "And things got better and better, and within 3 or 4 months I was discharged from the hospital."
The practice of electroshock therapy is still ongoing today. The public opinion really varies, from some people considering EST to be something that is less stressful than going to a dentist, while others are saying that it is a barbaric practice that should be banned. However, most professionals are arguing that it should be allowed due to the fact that it actually works regardless of the risks.